There is a secret language of pain. It's the silent calculation before you agree to a long car ride. It's the quiet dread that clouds a dinner invitation. It is the invisible force that can isolate you from the simple joys of life, making you feel trapped by your own body. This is the reality for millions who suffer from a condition we rarely speak about, with the seriousness and compassion it deserves. Today, that silence ends. We're going to pull back the curtain on hemorrhoids and replace confusion with clarity. My promise to you is that by the end of our time together, this topic will no longer hold that power over you. So please, stay with me. Hello and welcome. I'm your host, and as a specialist in this field for over a decade, I've had thousands of conversations about this very topic. And the most common thing I see in my patients isn't just physical pain, it's the emotional weight of misunderstanding. My goal today is simple: to give you a clear, straightforward, and compassionate explanation of what hemorrhoids truly are. But first, it is my professional and ethical duty to state that this video and its content are for educational purposes only. They are not a substitute for professional medical advice from your own physician. If you are experiencing any symptoms we discussed today, especially pain or bleeding, please make an appointment with a qualified healthcare provider for a proper diagnosis. All right, let's begin by clearing up the single biggest misconception. If you ask 10 people on the street what a hemorrhoid is, 9 of them will describe it as something that grows, like a skin tag or a wart. That's not accurate. The simple truth is, we all have hemorrhoids, right now. They are a perfectly normal part of our anatomy. Think of them as small, spongy cushions or pillows filled with blood vessels that line the inside of your anal canal. These vascular cushions are there for a reason. They play a supporting role in continence, helping to provide a tight seal to prevent leakage and giving us sensory information about what's in the rectum. So, if we all have them, when do they become a problem? The problem, what we call hemorrhoid disease, arises when these normal cushions become swollen, stretched, and inflamed. Imagine a small, perfectly functional pillow. Now imagine immense repeated pressure being put on that pillow day after day. Eventually, the fabric would stretch, the stuffing would bulge, the supportive threads holding it in place would weaken, and it would become a lumpy, painful mess. That, in essence, is what happens to our hemorrhoidal cushions. When they are subjected to too much pressure, they stretch, swell, and bulge. And that is when they start causing the symptoms that we all know and dread. To understand your symptoms, you need to know where they're coming from. Hemorrhoids are categorized based on their location. Medically, we classify them as either internal or external. Internal hemorrhoids are located on the inside of the rectum. The key point is that the lining of the rectum has very few pain-sensing nerves. Because of this, internal hemorrhoids are usually painless. You often don't even know you have them. The most common sign is painless, bright red bleeding during or after a bowel movement. This is because the thin, swollen surface of the hemorrhoid can be easily broken by passing stool. When internal hemorrhoids become very large, they can stretch and slip down until they bulge outside of the anus. This is called a prolapsed hemorrhoid, and doctors often grade its severity. A grade 1 hemorrhoid just bulges slightly, but stays inside. A grade 2 prolapses during a bowel movement but goes back in by itself. A grade 3 prolapses and you have to manually push it back in. And a grade 4 is one that has prolapsed and stays out permanently. A prolapsed hemorrhoid, especially at the later grades, can become very painful, irritated, and produce significant mucus and discomfort. External hemorrhoids form under the sensitive skin around the outside of the anus. This area is full of pain-sensing nerves, and for this reason, they are responsible for most of the acute symptoms we associate with a flare-up. This includes a dull, throbbing ache that makes every chair feel like a bed of nails, or a persistent, nagging itch that's impossible to satisfy. You may also feel swelling or a palpable, tender lump near the anus. There is a particularly painful variant called a thrombosed hemorrhoid. This is when a blood clot forms inside the hemorrhoid. It typically appears suddenly as a hard, swollen, bluish lump and can cause severe, intense pain that makes walking, sitting, or any movement at all feel agonizing. This is often the event that finally prompts a person to seek medical help. So what's causing all that pressure we talked about? It's rarely a mystery. It's usually about simple mechanics and daily habits. Straining on the toilet is, without question, the #1 cause. When you bear down, you dramatically increase the pressure in the veins of your lower rectum. Doing this repeatedly is the single fastest way to inflame your hemorrhoidal cushions. This is directly connected to chronic constipation or diarrhea. Constipation leads to hard stools, which forces you to strain. But chronic diarrhea is also a problem, as frequent, acidic bowel movements can be highly irritating and inflammatory to the entire region. Prolonged sitting, especially on the toilet, is a major modern contributor. When you sit on a toilet, the anus relaxes and lowers, allowing blood to pool in the hemorrhoidal veins. This is why reading your phone for 15 minutes in the bathroom is one of the worst habits for hemorrhoid sufferers. A low-fiber diet is the primary driver of constipation. Fiber is like a sponge. It soaks up water in your colon, creating soft, bulky, easy-to-pass stools that don't require straining. Without it, stools are hard and difficult to pass. As we get older, the connective tissues that anchor the hemorrhoidal cushions in place can weaken and stretch, a bit like a worn-out elastic band. This makes them more likely to prolapse, even with less pressure. Pregnant women face a double whammy. The weight of the baby puts direct pressure on the pelvic veins, while pregnancy hormones cause the veins themselves to relax and swell more easily. Finally, regularly lifting heavy weights causes you to strain and increase pressure throughout your abdomen, which gets transferred directly to the rectal veins. As you can see, these are not character flaws. They are physical forces that lead to a predictable outcome. For most people, hemorrhoids are a painful, temporary nuisance. But if they become chronic or severe, they can lead to more serious issues. While rare, chronic blood loss can lead to anemia. This means you don't have enough healthy red blood cells to carry oxygen, which explains the profound fatigue and weakness some people feel. A strangulated hemorrhoid is a medical emergency. If the blood supply to a prolapsed hemorrhoid is cut off, it can cause excruciating pain and tissue death. Sometimes external hemorrhoids can develop open sores, which can become infected. This is why toughing it out isn't always the best strategy. Understanding these risks is part of taking your health seriously. So, let's go back to that invisible wall we talked about at the beginning. Today, you've learned that hemorrhoids are not some strange growth. They are a normal part of you. You've learned that the problem isn't a personal failing, but the result of pressure. You know the difference between the ones on the inside and the ones on the outside. And you know the forces in your daily life that contribute to the problem. This knowledge is the first tool you need to start dismantling that wall. It removes the shame. It removes the mystery. It empowers you to look at your own body and your own habits with understanding, not frustration. This is the foundation. From here, you can begin to make meaningful changes and seek the right kind of help. And I want you to know, with absolute certainty, that relief is possible. Thank you for trusting me with your time today. I hope this explanation has brought you some clarity and peace of mind. In our next video, we will build directly on this knowledge and walk through the most effective treatments available. If you found this helpful, please consider giving it a like and subscribing so you don't miss what's next. And please, think about sharing this video. You may have a friend, a parent, or a partner who is suffering in that same silence, and this simple explanation could be the first step on their journey back to a life without walls. Be well and be kind to yourself.